Have you ever heard that your gut has a direct connection to your brain? This connection is called the gut-brain connection, and it is a major two-way communication system. Your gut and your brain are constantly talking to each other. They're telling each other what's going on and adjusting bodily functions accordingly. For example, when you eat something that doesn't agree with you, your gut can send signals to your brain to make you feel sick to your stomach. Or when you see a scary movie, your brain can send signals to your gut to make you feel nauseous. What's really crazy is that most of these signals go in one direction from your gut to your brain. In other words, your gut has a bigger influence on your brain than your brain has on your gut. And there is a lot that your gut is trying to tell you. In fact, some researchers think that many psychiatric disorders may be caused by problems in the gut-brain connection. So today we are going to talk about how the gut-brain connection works and how it may affect your anxiety. We'll also talk about the role of psychobiotics, which are probiotics that can help to improve your mood. So if you're ready to learn more about the fascinating connection between your gut and your brain, keep watching. If you stick around until the end, we'll share a free guide that will teach you how to use your diet to control your anxiety levels. And as always, this video is for educational purposes only. So do speak to a doctor if you have any medical concerns. The first thing that you need to know is that your gut contains a lot more nerves than the rest of your body. These nerves form a complex network that is known as the enteric nervous system. The enteric nervous system is so complex that it has been compared to a second brain. In fact, your enteric nervous system contains more neurons than the spinal cord. These neurons are located in the walls of your digestive tract and they control the movement of food through your gut. They also control the release of digestive enzymes and the absorption of nutrients. But the enteric nervous system does a lot more than just control digestion. It also influences your mood, your sleep, your appetite, and even your memory. For example, when you're anxious, your enteric nervous system can make you feel nauseous or give you a stomachache. Similarly, when you eat a meal, your enteric nervous system can send signals to your brain that tell you whether or not you've full. But what's really amazing is that your enteric nervous system is able to influence your brain because it communicates directly with it via the vagus nerve. The vagus nerve is a major nerve that runs from your brain to your gut. It's actually the longest cranial nerve in your body. When the vagus nerve is stimulated, it can cause changes in your heart rate, your blood pressure, your breathing, and even your digestion. Scientists are still learning exactly how the vagus nerve works, but it's clear that it plays an important role in the gut-brain connection. In addition to the vagus nerve, your gut also communicates with your brain via the circulatory system and the immune system. For example, when you eat, your gut absorbs nutrients and sends them to your liver via the circulatory system. Your liver then releases hormones that tell your brain that you have eaten and that it's time to stop feeling hungry. Your gut also communicates with your brain via the immune system. Your gut contains a large number of immune cells that can sense when there is an infection or inflammation in the gut. When this happens, the immune cells release chemicals that travel to your brain and trigger inflammation there. This is one way that a gut infection can lead to brain inflammation and psychiatric disorders. Now let's take a look at how this gut-brain connection affects your anxiety. As we mentioned earlier, anxiety can lead to physical symptoms in the gut, such as nausea and stomach aches. But these symptoms are actually just the tip of the iceberg. Anxiety has a profound effect on the gut-brain connection. And understanding this connection can help us develop new treatments for anxiety disorders. When you're anxious, your brain sends signals to your gut via the vagus nerve, the circulatory system, and the immune system. These signals cause changes in your gut motility, secretion, and permeability. Gut motility refers to the movement of food through your digestive tract. When you're anxious, your gut motility can increase or decrease. This can lead to diarrhea or constipation. Gut secretion refers to the release of digestive enzymes and mucus. When you're anxious, your gut secretion can increase, leading to more gas and bloating. Gut permeability refers to the ability of molecules to pass through the gut wall. When you're anxious, your gut permeability can increase, leading to leaky gut syndrome. In addition to these changes in gut function, anxiety also causes changes in the composition of the gut microbiome. The gut microbiome is the community of trillions of bacteria that live in your gut. When you're anxious, the balance of bacteria in your gut can shift, leading to dysbiosis. Dysbiosis has been linked to a variety of psychiatric disorders, including anxiety and depression. So how can you improve the gut-brain connection and reduce your anxiety? One way to improve the gut-brain connection is to eat a healthy diet. A healthy diet is one that is rich in fruits, vegetables, whole grains, and lean protein. A healthy diet provides the nutrients that your gut needs to function properly. It also helps to maintain a healthy gut microbiome. In addition, a healthy diet can reduce inflammation in the gut, which can lead to less anxiety. Another way to improve the gut-brain connection is to manage stress. Stress can have a negative impact on the gut-brain connection. It can lead to changes in gut motility, secretion, and permeability. It can also lead to changes in the gut microbiome. There are a variety of ways to manage stress, including exercise, yoga, and meditation. But the best way to manage stress is to identify and address the sources of stress in your life. This may not be easy, but it is important to try because chronic stress can have a number of negative consequences for your health. Finally, you may want to consider taking a probiotic supplement. Probiotics are live bacteria that are beneficial for gut health. They can help to improve gut motility, secretion, and permeability. Probiotics can also help to restore a healthy gut microbiome. Some probiotics have been shown to reduce anxiety in humans. So they may be worth trying if you're struggling with anxiety. We mentioned earlier that there are certain probiotics that can help to improve your mood. These probiotics are known as psychobiotics. Psychobiotics are a type of probiotic that has been shown to have a direct effect on the brain. They do this by crossing the blood-brain barrier and interacting with brain cells. Several studies have shown that psychobiotics can reduce anxiety and depression in both animals and humans. One study published in the Journal of Psychiatric Research found that a probiotic containing Lactobacillus reuteri reduced anxiety in a group of healthy adults. Another study published in the journal Emsphere found that a probiotic containing Bifidobacterium longum improved depression and anxiety in a group of overweight adolescents. While research is still in its early stages, it is clear that psychobiotics have a lot of potential as a treatment for mood disorders. So what should you look for in a probiotic supplement? When choosing a probiotic supplement, look for one that contains a variety of different strains of bacteria. The more strains, the better. Also, look for a supplement that contains a high number of colony-forming units or CFUs. The higher the number of CFUs, the more bacteria are in the supplement. Finally, look for a supplement that has been shown to be effective in reducing anxiety. You can find this information on the product label or website. It's important to note that not all probiotics are created equal. Some probiotics are more effective than others at reducing anxiety. In addition, some probiotics may cause side effects such as bloating, gas, and diarrhea. If you experience any negative side effects, discontinue use and consult with your healthcare provider. You may be wondering how long it will take to see results from a probiotic supplement. This varies from person to person, but you may start to notice a difference in your anxiety levels within a few weeks. It's important to continue taking the probiotic supplement even if you don't feel an immediate difference. So what should you do if a probiotic supplement doesn't work for you? There are other options available to help improve the gut-brain connection and reduce anxiety. These include eating a healthy diet, managing stress, and exercising regularly. You may also want to consider seeing a therapist to learn coping mechanisms for anxiety. As we mentioned earlier, your gut contains a large number of immune cells. These immune cells can sense when there is an infection or inflammation in the gut. When this happens, the immune cells release chemicals that travel to your brain and trigger inflammation there. This is one way that a gut infection can lead to brain inflammation and psychiatric disorders. In addition to infections, inflammation in the gut can also be caused by autoimmune disorders and irritable bowel disease. When inflammation occurs in the gut, it can lead to a number of unpleasant symptoms, including abdominal pain, diarrhea, and weight loss. But inflammation in the gut can also lead to changes in the gut microbiome. These changes can lead to dysbiosis, which has been linked to a number of psychiatric disorders. Fortunately, there are a number of things that you can do to reduce inflammation in the gut. One is to eat a healthy diet. A healthy diet can help to reduce inflammation throughout the body, including the gut. In addition, a healthy diet can help to maintain a healthy gut microbiome. Another thing you can do to reduce inflammation in the gut is to manage stress. Chronic stress can lead to inflammation in the gut. So finding ways to manage stress, such as through exercise or yoga, can be helpful. You may also want to consider taking anti-inflammatory medications, such as ibuprofen or naproxen. However, it's important to talk to your doctor before taking any anti-inflammatory medications, as they can cause a number of side effects. If you're concerned about inflammation in your gut, talk to your doctor. They can perform tests to assess your risk of gut inflammation and discuss treatment options with you. If you liked this video, you might also like another recent video we did on 6 foods to calm your nerves. These foods contain natural compounds that can help to relax your body and calm your mind. So if you're feeling anxious or stressed, be sure to check out that video. Thanks for watching. Remember to like and subscribe for more informative mental health videos. And as always, this video is for educational purposes only.